The Kashechewan First Nation nursing station normally operates with 9 primary care nurses, but since late July they have been down to 3. And Health Director Jonathan Solomon says this means emergency services only.
I also have to acknowledge that there's a shortage of nurses across the province or across the country. I acknowledge that. But at the same time, like the press release says, we're isolated, we're remote. We cannot jump into a vehicle and go to another health center. So that's a situation we are in my community of here in Kashechewan.
Solomon says the situation is further complicated by the fact Kashechewan is located on the shores of James Bay and is a fly-in only community for most of the year.
The walk-ins that come in, that used to come in every day, or appointments, they don't even take appointments. Blood work, people with diabetes, or prenatals. We got women here that haven't had their prenatal appointments for quite some time now.
Indigenous Services Canada recently announced increases in both recruitment and retention allowances for nurses working in communities it serves. Solomon says this is a good start, but there has to be more. Canadian Nurses Association President Sylvain Brosseau agrees. He says governments need to create a healthy and safe work environment for nurses and step up the recruitment of Indigenous nurses.
Promote the nursing profession even among Indigenous high school students. Also increase Indigenous student recruitment and retention through nursing student program, bursary, mentoring, and also about academic and experiential learning opportunity for them. For instance, we should include inclusion of Indigenous way of knowing and being into the nursing academic program.
Brosseau says now is the time to tackle the nursing shortage across the country.
We are in a crisis, and this is something, as I said, since 5, 10, 15, 20 years, and we cannot keep it like that because it's going to be I don't want to be negative, it's going to be a collective burnout. I mean, it doesn't make sense that that nurses always work overtime all the time.
In an emailed statement to APTN, ISC says it is committed to providing healthcare services to remote First Nations and is working closely with the community to address staffing shortages. Fraser Needham, APTN National News, Ottawa.